Hello, everyone, and welcome to the Operation Miss podcast. I could not stop smiling. I've been smiling since we decided we were going to have this conversation because I get to interview a woman that I have got to watch grow up from when she was, Jessica Thompson, the student, to Dr. Jessica Thompson, the mentor and supporter and fierce advocate of moms, to now the mother and wife, Dr. Jessica White. And it feels like it has happened in the blink of an eye. I am so honored. I'm so honored. I am so honored to be here with you. And I cannot think of a more full circle moment in my mind for you as a woman. And being able to witness it is truly a gift. So you already know some tears are going to come at some point, but I would love for you to introduce yourself to the listeners, anything that you want them to hear. Everyone who follows us knows that this podcast is really meant to empower women, for them to hear the stories of other women so that they can know how to learn, trust, prepare, and protect their bodies throughout every phase of womanhood. And there's truly nobody better to teach them how to do that than you. And so introduce yourself, please, Dr. White.
I keep forgetting that's my married last name, but I'm Jessica. I'm a pelvic floor physical therapist. I got started with Catherine with Operation Miss at the very beginning. And I almost kind of took a hiatus because in like less than a 2-year span, I got married and I got pregnant, and pregnancy was not the easiest for me. But now I have my baby. I had my baby at a birth center, and I really want to share details with you guys about what it's like giving birth in a birth center compared to home birth or hospital birth. And now we're here, and I'm just like, I'm 2 months postpartum. I'm slowly getting back to like the things that I'm passionate about, which is definitely doing things like this, like having these candid conversations and talking to moms and advocating to moms and serving moms. I just started back treating moms at the hospital, PRN, at Piedmont Snellville here in Georgia, and slowly starting back to seeing people virtually for my business, which is great. I had a birth preparation session with a mom not too long ago, which was great. And I'm getting back to childbirth education and teaching a class here really soon. I just gave away a class to a sweet mom to be. So things are getting back to the usual, or whatever the new normal will be.
Yeah, yeah. So can you tell me when you were, and I know some of your story, but I want everybody to really know what brought you to maternal health. So when you were in school, did you know that you wanted to work with moms?
Well, I didn't necessarily know I wanted to work with moms specifically, but I knew I wanted to be a pelvic floor physical therapist. I went to PT school in 2017, I want to say. And so from like 2016 to 2017, I was a technician at a physical therapy clinic. I just applied. I wanted to have a job that would look good while I was applying for PT school, right? But I had no idea that the clinic was a pelvic floor clinic. And usually in outpatient physical therapy clinics, they might have like one pelvic floor physical therapist that does it some of the time. But at this clinic, it was like 100% pelvic floor. Every therapist there were pelvic floor therapists. And they were the only one of its kind for like miles. This was in like the top of Mississippi, close to Memphis. There would be people to cross the river from Arkansas to come see these therapists, just because the scarcity of pelvic floor therapy is real, and especially those in like clinics that take insurance. So I saw the need, and that made me want to do it. But also just, I was the one to call patients to schedule them. And so people would have so many questions like, what am I walking myself into? What is this going to look like? And people were just like so hesitant about it at first, and they'll walk in, they'll be kind of nervous. But I would notice a transformation when they walked out. You know, people would be just way more confident. Obviously, their symptoms are better if not completely resolved, and then they will go and tell a friend. And so I just love seeing that transformation and seeing um, people empowered, and particularly women. This clinic saw men too, but mostly women, right? And so that's how I knew I wanted to be a pelvic floor therapist. Fast forward, I graduated PT school in 2020 and pandemic, okay? And I got a job at a clinic that I said I would never work at. That's another story for another day. Scarcity, and I needed the money, okay? But once I got that job, it was like an orthopedic practice. I started just seeing pelvic floor patients and kind of like started up a little pelvic floor program there, which was just me treating folks. And my first patients were moms, and particularly like young moms, like just getting started, first baby, like what is happening to my body type of thing. And that's when I really fell in love with moms. And that's also when I really realized I'm also at the clinic where I was a technician too, but you just realize how hard it is for moms to get out and do anything for themselves, really, you know? So it's like if a mom with a small baby, we're talking about recently postpartum, um, has to get out of their house. I mean, usually they're not going out of their house like leisurely. It's like, okay, there's no way around it. I have to be the one to go and I have to bring my baby. But whenever there's an option for them not to leave their house, and just keep their baby at their homes with them, they would take that option any day.
Yeah.
And so that would bring about challenges. Like probably the most cancellations or no-shows we would get would be like for moms, because especially if they had other kids, there's so many things going on. And so that's why I started my practice. And it was a mobile practice, right? So I would go into moms' homes and treat them there. So they didn't have to leave their homes, they didn't have to leave their babies. It was all fine. So it was just easier for them if I did the work, right? Because at the time I was single as a dollar bill, honey, no kids, no man. I could go anywhere. And so I did, and it was really fun. And I also saw people virtually. And so fast forward right now, me being recently postpartum, I'm just treating people virtually because it's just easier for me at this stage, like not having childcare always available.
Yeah, yeah. Now, can you talk a little bit about that? So, how effective do you feel pelvic floor physical therapy is across the computer screen? And do you recommend people always doing it virtually, or do you still feel like there are times when you have to refer to someone who does see people in person just because you've encountered maybe something that can't be solved over virtually?
You know, I'm just looking at the people that joined. Hey, everybody that joined on live, but not right now. So right now, I have never had to refer someone out because what we've been working on virtually wasn't enough. But I'll be remiss to say that that will never happen. I believe that it will one day, you know. What comes to mind is like sometimes some people with really chronic pain disorders who will have an issue with doing a self pelvic exam that's guided by me. Those may be people that I would probably likely refer out, right? I hadn't had anybody like that virtually. I've treated people like that in their homes. But I hadn't had anybody like that virtually. But I can just see in the future if I get someone like that who is super hesitant to doing a examination on themselves, that I may have to refer them out. But some of the folks that it really works with is a lot of times postpartum moms, a lot of times pregnant moms, so moms um who I've got mommy brain, I'm sorry.
It's okay.
So pregnant moms, moms who are looking to like prepare their pelvic floor for birth.
Yeah,
Those sessions work really well because it's a lot of education, right?
absolutely.
So that really works really well. And then postpartum, like check-in, their abdomen for diastasis to see if it's still there. I'm working on those like core retraining exercises. That works really well. Folks who are dealing with incontinence, so leaking urine when they cough or sneeze, and it's not super complex. That's super easy to treat virtually. So it really depends. But like I've talked to all of my folks on the phone before we have our first session, and I was do like a screening, try to get to know them, but also try to see if this would be a good fit for them. And during that time, if it's not, then I would refer them to someone else. Because I know a lot of pelvic floor therapists in the Atlanta metro area.
Yeah, yeah. So what caused you to go on to get your childbirth education certification?
Operation Mist.
Mm.
So, when we were doing like the early stuff for Operation Mist, and we would have all these meetings, and people would always ask like, "Are y'all doulas? Are y'all, childbirth educators and this and that?" And I'm like, we're like, "No, we're just pelvic floor therapists that love moms." But like I said, I did start to have that soft spot for moms, and my first official patient was a mom early postpartum, and she asked me so many questions that truly were like out of my scope as a physical therapist. It was more for someone who would be like a doula or a childbirth educator. And the first resource that I found that was like reliable was evidence-based birth. And that's where I just sent her articles from. And a lot of my pregnant moms, I would send them the article that they posted about upright birthing positions. And so I got familiar with evidence-based birth because it was a free resource. And I could put it in the clinic really fast for patients. And so circling back around, Operation Mist made me want to be a childbirth educator. And so when I saw them post about their instructor positions opening, and I told you about it, and so I applied. And the application process, oh my God, y'all, it, it was something. But Catherine wrote me the best recommendation letter. I feel like that's why I got accepted. Thank you, Catherine. So that's how that got started. But I'm happy. I'm really happy with it.
Yeah, I'm so happy you did it. It's funny, did you know Dr. Amber is a pregnancy health coach, and now I'm a VBAC certified doula, and it's like
Mm-hmm.
you just realize that some of the gaps that you have can be filled very easily if you just get a little bit of extra education in the area that you want to excel in,
Mm-hmm.
and then it's like you said, you have access to the resources that you know are reliable and evidence based
Yeah.
while we are teaching women how to use their own data and do research on themselves. And so that way
Mm-hmm.
they can decide, does this work for me? Because there are a lot of different resources. And when we look at the way that research is done, it doesn't always take into account the outliers. And so I love just being in a position where we can sift through the information, share with them what we find, and then also help pair that with their data so they can make the most informed decision possible. It's the most beautiful marriage, I think.
It
And
is.
moms deserve it.
They do. All of them do. Yes.
Yeah.
1,000. I'm gonna sit my baby down because my arm is tired. She is.
Wait, before you do, can we see Billy? Oh, she's so beautiful. Okay, set that sweet baby down. You are the best mom.
Oh, thank you. We'll see how long she stays here.
Oh, it's fine. If she needs some more mommy time, then that is up to her. So
Oh, yes, it is.
so when Dr. White gets back, we are going to flash forward to her pregnancy experience. And I cannot wait for her to share because it was unexpected, right? Like tell everyone listening about your lovely pregnancy experience.
Oh man. This is so funny, y'all, because when me and Catherine like first started to get close, I was so far away from all of this, like having a baby, being married. Like I was so, it just didn't seem attainable to me almost. And so now being here, it's just like full circle. Because she will always say, "You're gonna be such a great wife, you're gonna be such a great mom." And like now here it is. But basically, um, I met my husband and we dated for about a year and we got married. We got engaged and married on the same day. So that's our things were just moving fast. Which is how how we wanted it to be. That's another podcast. Anyway, so that day that we got engaged and married, that night, he booked a hotel and I didn't all these things are like surprises, right? It was so great, like a fairy tale.
Oh,
We with Operation Meets, we do body talks and we have period parties, right? And we talk about um the cycle, right? And how um you can't get pregnant anytime on your cycle, right? But there's a window and it's not just ovulation. Okay. Um, so I not on birth control, right? I hadn't been since I was like 17. I hate the way it makes me feel. And
mhm.
I just don't ever want to get back on hormonal birth control. But anywho, so I would track my cycle, which is what we teach people how to do with our period parties. And
You are so funny.
I did not, I mean, it was my wedding, technically, my marriage, whatever you want to call it, night. And I knew, so my period was ending, okay? Like it was on the end, right? And there is a time, depending on like the length of your cycle, right? And when you ovulate, you can get pregnant on your period or a
How
little
close
bit.
to mine came.
Say it again. That's what happened to you?
Because I'll be late on day 11 and I could bleed for 6 days. And so, yeah, there you
Exactly.
have it. That's super
So
strong sperm staying alive 5 to 7 days.
exactly. So I believe, I had a honeymoon baby because it's your technically my honeymoon. I did not want to, I just wanted to enjoy myself. Okay.
Right.
And try to be careful and other things. And at this point I'm married. So like if it happens, it happens. But um it's how it did. It happened. And there you go. So um yeah, I remember like some of my first symptoms were like insomnia, like sleeping was different. And I also remember having to urinate at night. And I could sleep through, and I'm thinking about pelvic floor patients and stuff.
Oh, I love this. Like, that's why it's so good to interview a healthcare provider and monitor because you're going to give all the things that people ask us. So please
Yeah.
take your time. Insomnia, having to get up.
Yes, yes. So I could, it's normal to um get up maybe once a night. Okay. But I never even had to do that. Okay. But after um that happened, I woke up like 3, 4 times. I would go to the bathroom, it would be a lot, right? So body's adjusting to we're trying to get started with the new blood volume and all these fluids and things like that. So I was going to the bathroom more and I'm like, I knew it, but I didn't want to know it, right? So I'm like, oh my goodness. So that was the real like first signs for me. And I went to my PCP to confirm, right? I did take a pregnancy test at home, it was positive, but I wanted to go to my PCP too. They probably gave me the same pregnancy test, who knows? But they came back so fast and they were just like, yeah, you're pregnant. And me and my husband just looking at each other like, okay. And so I'm telling you, after that same day when I did that, that's when my nausea started.
Mhm.
And I think I vomited that night. And then after that, it was like nonstop for the pregnancy.
Um,
And so that's what it was for me. It was a difficult pregnancy journey because I'm this pelvic floor therapist, and I had all these pregnant patients, and I'm telling all these people, make sure, um, make sure you're moving, and exercise recommendations are the same for pregnant women as normal women, except for different positions. And I could not get out of the bed.
Yeah.
It was so many days where I was literally in the bedroom, like blinds closed, laying in the bed, like curled up. Got up maybe twice in a day to go to the bathroom, but other than that, it was just like to
Mhm.
vomit outside of the bed and then to curl back up.
Wow.
It was like that for a while, and there were many like urgent care visits. There was one emergency room visit. I had a lot of UTIs in between because I was so dehydrated.
Yeah.
Um, and I never really get UTIs either. So it was just so much happening at once. And then first trimester went, and they say it's just the first trimester thing, you get over it. And so I'm in second trimester and it's like the same. And
Yeah.
so then like I don't want to say, well, kind of sort of like hopelessness starts to like settle in, right? Because people say, oh, well, you need to eat more protein, or you still need to drink more water or more like electrolytes and all things. And I'm like, okay, but it's gonna come right back up. So am I getting the benefit of it? So it was just like cycles and cycles and cycles. It did get to a point where I was able to keep red meat down more, probably because my body needed the iron. So it was a whole lot of like plain cheeseburgers for a little bit. Sometimes some steaks and potatoes would stay down, but it was a long journey with just super, super fatigue and nausea and vomiting. Um, and I will say I was seeing a therapist at the time, a mental health therapist, which is someone that I was seeing before pregnancy. And the depression scale that they have you fill out,
Mm.
obviously, like I'm a patient, but I still like look at it with a provider lens a little bit. I didn't realize how, if you're someone with like chronic like nausea, this could be like a cancer patient even. If you look at that form, most of the things that it asks you are things that would be affected by it, right? So like you could not even feel depressed, quote unquote. But if you like read that scale, it's like, questions about like doing things that you enjoy or da da da. And it's like
Mm.
when you're like chronically nauseous, it's like, no, I'm not doing things, or and I can't think of all the questions. I have to like pull it up, but it was like almost every question, because I was physically feeling that way.
Right.
This like mental health screen is like scoring this way. And if you really think about it, it just shows like the ties between your physical health and your mental health.
Yeah.
It's like really, I couldn't even believe it. I'm like, oh my gosh. So like during pregnancy, like or early pregnancy, I'm like scoring like I'm like severely depressed, right? And then as it did get a little bit better, throughout. It got better. It was just like slow and very little bits at a time. Once it did get better, then I was like, I don't know, maybe like mildly depressed or whatever on this screening. But it just correlated so perfectly with the way that I was physically feeling, what I
Right.
was scoring on this mental health screen.
Yeah.
Yeah.
That's very important to bring out because I think both the tie and the possible misperception, because you can be not doing the things that you want to do because you're not physically able to do them, but you're still mentally okay.
Mm-hmm.
In reality, moving helps with your mental health, and so
Mm-hmm.
it puts you on a trajectory
Yeah.
towards depression. You're
Yes.
not able to actually get up and move, and just having having people to walk the journey with you can help, right? Because if you're in the
Mhm.
bed by yourself, but you have FaceTime, then maybe,
Mhm.
you can balance that out by doing things that do bring you joy.
Yeah. Yeah, for sure. I'm gonna peek at her.
Okay.
Okay. She's just moving a lot.
Yeah.
So that was the, I would say, building my birth team, right? Because I like to talk to people about that, especially with the childbirth classes. So my PCP was the first start. And then after that, a lot of urgent care docs. But then my therapist, right? She was a part of my birth team for sure.
Yeah.
And so early on, I knew I wanted to do a home birth. Okay. But things happened really quickly. I was not prepared for that. We just got married. His lease was about to end. My lease was going to end shortly after that. We didn't even know we were going to be buying a home, all the things. So, like, I'm like, okay. But we have this birth center in Atlanta that's a good in between. Um, so early on, we went to the birth center. They make you do an orientation. They are pretty strict with the people that they accept. And not anybody can just walk in to the birth center or call them and say, hey, I want an appointment, I'm pregnant. It doesn't work like that. You have to do this orientation. And it's with the midwives, and they educate you about, the risks, the benefits, who they accept, who they don't accept, their criteria for like applicants. And so after that, they give you a tour of their center and their birthing rooms and all the things, and where you would go for checkups and where you would go for triage when you're in labor, and then where you will ultimately go to give birth. And after that, you can decide whether or not you want to birth there. And if you do, you can apply. And you have to do like two different applications. I think you do like an application based on like your medical history to see if you qualify. And then also there's another like financial application, because they accept some insurances, but it's not as inclusive as like a hospital would be. So I have Blue Cross Blue Shield, Anthem, and it was partially accepted. So I had an out of pocket cost, or out of network costs, if you will, that they also do payment plans for you throughout, and I think they expect it to be paid before you give birth. So we were making payments throughout. But anyway, so we applied and we accepted, because I'm not over 35. I think you have to be under 35. I wasn't pregnant with multiples. They won't allow you to give birth to twins or triplets or anything like that at the birth center here in Atlanta. Um, I didn't have any comorbidities. I'm not sure. I can't remember if it's like a hard no if you have like hypertension or diabetes or things like that, but I'm sure they want to know about it. And there were some other things. But anyway, I qualified. So that's where we decided to give birth. Now, this sounds like it happened really quickly, but it was like a process, right, with applying and us deciding that for sure this is what we wanted to do. Um, and there were also all of these appointments that they want you to have on time, or else like maybe an OBGYN won't even want to see you, right? So I can't remember. Was it 12 weeks? Um, Somewhere between 12 and 18 weeks. There's this appointment that you would have with your OB where they, take blood, and they do like a vaginal ultrasound, and they're checking out these lab values and things like that, and making sure the pregnancy is viable, making sure your cervix and your uterus is viable and all the things. And so I had to try to get that done to make sure that I'm like on top of these things. And so I was seeing the OB2 at the same time, da da da. So anyway, long story short, I ended my care with the birth center. And it was great. And compared to my OB visits, they were longer, and it didn't feel like longer like I was like waiting in the waiting room for a long time, like longer like just a little bit more intentional. It seems like they had the time to educate.
Yeah.
That's what took most of the time. It's just the education with the birth center visits. So that was really great. And each time we were educated on different things, and each time they would kind of like remind you of what to expect for the phase of pregnancy that you're in, like what is next. So that was good. And also even there, because a lot of people hear birth center and you think home birth and you think that it's like nothing medical at all, but that's not true. Like they have phlebotomists there. You can get your labs drawn there. You get your, do your urine. They do the urinalysis, all the things that you would normally do with your OB visits. All of those things are accessible there as well. The Doppler to check the baby's heart rate and all the things that was there too each time for the visit. So it was like I said, identical to the OB visits. Besides, it was a little bit lengthier because there was more education, which I liked.
Yeah. Yeah. That's awesome.
Mhm.
So, can you give some tips? So, I remember when you made your post on Instagram and you were kind of out in the gym. So, how did you get there in your pregnancy and how did it feel physically and mentally to be able to do that?
Oh yeah. So there were days where I felt better, or moments where I felt better, and I wanted to capitalize on it. And so I'll be honest, like I made that post. I went to the gym. I probably went to the gym like 3 times my whole pregnancy, right? And those were days where like I was able to hydrate more. Um, I was able to eat more. And so, or maybe like the day before, I was able to drink more, I was able to eat more. So I'm like, okay, I could go to the gym. But to me, and I think this is important for moms because everybody's pregnancy is different. If you're having a pregnancy more like mine, where you're not eating, you're not drinking, you don't need to go to the gym and sweat and burn calories. You just don't. It
Mhm.
doesn't make sense. Yes, movement is beneficial and we need to, but for you at that time, it doesn't make sense. So when I was able to keep things down and I felt better, then I would go. But if I had been throwing up 5 times the day before and I couldn't drink anything, I'm not going to the gym.
Yeah.
I don't want to burn calories and I don't want to sweat and things like that. And towards the end, like I said, when the nausea and vomiting was better, maybe it was once or twice a day, you know, with like meals or something like that, like more predictable, like towards the end, then walking was my form of exercise. And I would do it kind of like around lunchtime at work or in the evening at home, just like walk around the building or walk around the block. And that was more doable for me. And also, um, I would do it at a time of the day where it wasn't like too hot, so I wasn't like sweating and uncomfortable and all the things. And so that's what worked for me. So I guess first trimester, I don't think I did anything. Okay, second trimester, I think that's when I went to the gym a few times. And then third trimester, it just made more sense. It was easier for me to just do walking and like some stretching and things like that. And so that's what I did third trimester.
I love that. And I love that you shared that because moving really is just that. And I think that removing the word exercise or replacing exercise with movement could help the people listening to understand that it literally is just moving, making sure that you are not completely still, and then modifying the things that you can modify because you did work, you did do house shopping, like
Oh
you
yeah,
had
yeah.
a lot of stuff to do that was on your plate. And we have to think about, especially if someone's listening and they are being monitored, they understand that when you wake up in the morning, if you open up your app and you have a body battery, your body battery is 100, it's like a gas tank, right? Then it's a full tank of gas, and you know that you get out and kind of do whatever you want to do.
Mhm.
If you wake up and you're on a 5, which is the equivalent to it empty on a gas tank, then you really have to look at your to-do list and say, okay, is this something that I'm going to do, delete, delegate, or delay? And so if you just go through those 4 Ds, right, then you can make more informed decisions because while we think about exercise as like an intentional 20-minute walk or a trip to the gym, if you're moving because you're going between houses or working, even if it's part time, that still is challenging your body. And if you don't have the calories or the hydration to meet the need, it can make for a very difficult pregnancy. And everyone cannot quit their job. And so I know sometimes people are like, well, just try not to work during your pregnancy. That doesn't work for everybody. So we just have to
Okay.
figure out how can we prioritize our yeses so that we're not putting ourselves in a compromising position. You
Mhm.
know?
Absolutely, absolutely. And I did that. I had a transition, right, because I was so nauseous and I was just weaker. I could not like lug a therapy table into people's houses and walk up and down stairs and stuff. I couldn't do that. So I stopped treating people in their homes when I was pregnant for my health and my sanity. And I started working more at the hospital, and I had the best coworkers in the world. Cause there would be times, it's funny now, but it wasn't then. I would be talking to patients, and you would finish with a patient and they just love you and they want to keep talking. And I would literally have to like jolt to the bathroom to prevent from like projectile vomiting in this patient's face that won't stop talking to me. And I had coworkers that would like help clean up, and um the private treatment rooms that we had, they would bring me sheets and applesauce and ginger ale and crackers, you know what I mean? So I had the best coworkers to help, and ginger candies, and everybody was just trying to help. It was the best environment. So I will say too, like when you are pregnant, and especially early on in pregnancy, when you don't look pregnant but you going through it, you start to notice the people around you, and if how much they really care about you, and especially in a work environment, if they see you just as an employee or like as a person. And like I will say, at that PRN job that I have, they really saw me as a person, and it was so. I wished every mom that's pregnant, like going through those ebbs and flows, had that type of working environment. But I know they don't. I wish they did.
Yeah, yeah. Okay, so take us to your delivery. So, okay,
Okay,
what
okay.
happened when you went into labor? Tell us all the details. How did you know you were going into labor? When was your due date, quote unquote, and when did everything get started? I'm so excited to hear the story.
Hold on one second.
Okay. And this is important. The reason, if you were not watching, that due date is in air quotes is because we know that it's just an estimation. And so we always think about the old Amazon before Prime came around, and there was a due range or like a delivery date range. And so that's how we think about due dates. If we slap on 2 weeks ahead, 2 weeks before, and 2 weeks after, that's kind of the range that we're talking about. And that way
Mhm,
we are not feeling scared or upset when our due date comes and goes.
mhm.
That can happen. But yes, please walk us through everything.
Yes, so I remember, so I was due August 21st.
Okay.
Well, she was due August 21st. Um, and I just felt no action. I do remember, the weeks leading up to that. I was due August 21st. I think my last day working was like, I don't know, the first week in August or something. It was important for me to take some time before labor. So, and a lot of people would say, save all your time for after. First of all, I'm working PRN, so I'm not getting those benefits anyway.
Mhm.
Secondly, from monitoring moms, we saw how beneficial it was for the moms who didn't have to work before they had the baby, what that did for them. And I wanted that. I needed that because I had a long, rough pregnancy. Okay. So anyway, I took those 2 weeks. And so during that time, every time I go to the bathroom, I'm looking for a mucus plug. I'm looking for a little bloody show, a little pink here, nothing. I got nothing. Okay. And so I'm like, man. And so then at this point, you're going to, the birth center like every week, right? And so thank God I never had to get a cervical check. I never had to get that. A lot of you ask a lot of women and they say that hurts more than contractions. Okay, so I never had to get that there until, let me fast forward. So when I started to feel my first contraction, this was the next day. It was actually August 22nd. Okay, and it was like at 5 a.m. I went to the bathroom. And I had been having, you start to have contractions before, right? They're just like fewer and way farther between, to the point where you might even forget, okay? You might just feel like you're just uncomfortable for a little while. It's milder, all the things, right? So, but I knew I had been having them, those like abdominal contractions that were like short, I don't know, 5 out of 10 pain, like comes and goes. But at 5 a.m. on the 22nd, it was just a little bit different, a little bit more intense. And obviously, my due date, I'm past my due date. So I'm knowing, like, okay, it's starting. So we used an app. Oh man, I wish I could remember the name of the app anyway. But my husband used the app to, count the contractions. And this is so funny now. I'm going back to the day when I told him when I got my first, because we're waiting on it. I told him when, I was like, okay, I think I'm in labor now. Like they're, starting to be like, they're not rhythmic at this time, but it's like more and more. Okay. And he like called his sister, like, okay. We had my stepdaughter at the time. He's like, okay, you need to come and take her to school. And I'm like, baby, no, it's going to be a long time. We about to be dealing with this for a long time before we have to go to the birth center. Like, you can take her to school. I'll be okay. They happen like maybe every 30 minutes, whatever. But I remember them getting closer together way sooner than I thought.
Mm-hmm.
We learn about early labor and how, get some rest during that time if you can. Like take a nap, bake some cookies, whatever. But I just feel like, from at least my memory, how my memory is serving me, like around like the afternoon that day, I just feel like they were, maybe 10 minutes apart or something. Like I just feel like they got closer really quicker than I expected, right? And I feel like they were more painful than I thought they would be. So it's like now they're like 7 to 8 out of 10. And for me, even it started with front labors, what they call it, like lower abdomen, almost like a bad period cramp or whatever. But quickly it became like back labor. And for me, I'm saying back, like backside. It wasn't, I'm feeling in my low back. I felt it. It felt like it was in my bottom, right? So you hear some women will describe labor as, oh, it's like a really, really, really bad, like period cramp. And then some people will describe it like, oh, it's like you're taking the biggest poop of your life. It's like either one of those. So for me, it felt like the biggest poop, right? Backsided labor. And so I was sitting on the ball a lot. And I was doing low moans and low groans, right? I'm trying not to hold a lot of tension. So it was like ums and ahs and ohs, right? Throughout those contractions. And we did a little walk to the stop sign and back. And, by the time, like I might have had a contraction, he's like, okay, let's go for a walk. I'm sure my doulas told him to do that, right? They were farther away, so they didn't come to the house. They came to the birth center though. And so he was on the phone with them. And so my husband was like, okay, let's take a walk. So by the time we get to the stop sign, I'm having another contraction. So I'm like leaning over him and eyeing and oohing or whatever until it goes. And then we go back in the house. By around like 8 p.m., I'm tired. Okay. And so we go to the birth center and she's like, oh man, I should have wrote this down. I can't remember. I wasn't in active labor though. I might have been, I don't know, 4 centimeters or 3 centimeters, something like that. And I'm like, what? I'm thinking like, I got to be 6 or 7. Like, I don't want to leave here. So at the birth center, like if you're not in active labor, they're going to send you home. until you are. Okay. They only have in Atlanta, they only have like 4 birthing rooms. Okay. So they don't really have time for first
I
time.
love it. It's the reverse of the hospital. I'm sorry. I want you to send me home. Okay. Send me home. Let me finish. But this is so cool because
Uh-huh.
I feel like when we ask moms to wait for the 311 rule, so contractions are 3 minutes apart, each
Mm-hmm.
contraction lasts a minute, that pattern lasts an hour. We ask them to do that because if they go to the hospital and they're admitted, they're gonna stay, but there may be some interventions that occur.
To
But
get
you ran into the opposite route.
everything was the
I
opposite, right? Because
love
I
it.
was ready. I'm like, I know I gotta be, because she asked me at this point, right? She knew how many centimeters I was because she did check my cervix. This was the first one I ever got, and I was like, she asked me, "Do you want me to?" I was like, "Please, please, let's see." And so I wasn't in active labor, and the reason why I thought I was, to Catherine's point, was because things were closer together. The contractions were getting closer together. But my cervix just wasn't dilating as much as I thought it would be based on the contractions.
Sure.
So when you go to the birth center, you think you're in labor, they take you to triage, okay? This was the only time I had like a fetal monitor on. Okay, so they put that on. They're looking at this screen. They're looking to see what happens to baby's heart rate when mom has a contraction, right? Does it stay up? Is it steady? Is it going down really low? Does baby look like it's in distress? And so, hey, Catherine. I'm sorry. Hey, Jackie. I was looking at my live, but anyway, so they do that. And so they did that, checked my cervix. I wasn't dilated enough. So they gave me, and this is the only medicine that I received throughout my labor, was they gave me a shot. They called it therapeutic rest.
Okay.
Don't know if they call it that in hospital setting, right? So they gave me a shot for nausea. Also, nausea and vomiting came back full force for labor for me. Because at that point, third trimester, I maybe was vomiting like once a day, every other day, or something like that. But when I was having contractions, oh, yes. So anyway, so she gave me a shot for nausea, and then she gave me something to make me sleep. Because she was, this was a long, like started at 5 a.m. Now it's like 8, 9 p.m. I'm still not in active labor. So gave me that. And I'm telling you, and the shots were like in my shoulders. As soon as I got this shot, I was like, zonked. Okay. I was, it worked. It worked. So we went back home. I might have slept from like 9 to close to midnight. I woke back up, still very much those contractions. I'm talking 8 to 9 out of 10 now, super close together. And my husband's at this point, he's exhausted too. And I didn't even think about it, but like he's been up just like I've been up.
Yeah.
And we almost at 24 hours now. So he's like, okay, let's go back. And so we went back. I think I might have been 6 centimeters then. And, and I don't even know if they call it admitted there. But anyway, I stayed. I got the birthing room that I wanted, which was the water room.
Yeah.
There's a pool in each room, but their rooms are named like water, earth, fire, something else, And so I wanted the water room. And so I got it. And it looks like a bedroom. I mean, it's not a hospital bed, so it doesn't, that may or may not be a con to some people, right? So it doesn't have all these functions where you can let the head of the bed up and you can raise the bed up and down and all the things. But I had no lines, no tubes, my entire birth. So I was able to move around as much as I wanted to. The shower had like a little seat in there. So I was in the shower a lot. And I was at the counter, just kind of like leaning forward a lot. I brought my ball with me, so I was sitting on that a little bit. And once I got to active labor, sitting wasn't comfortable anymore. So I kind of stopped sitting on the ball. I did most of the sitting on the ball when I was at home. Um, so yeah, so that was that. So my doula was there then. So at any given time, the most people I had in the room was 5. Okay, I would have my doula, my husband. There were 2 nurses and a midwife. So that was the most that I would have in there. But the least that I would have in there was 2, right? My doula and my husband. And so I always felt like I had the support I need every wave. We like to call it waves with evidence-based birth, so it's not in negative connotation, but every wave, or quote unquote contraction I had, I could say, okay, babe, I want you to put your hands here on my pelvis, right? Or okay, Brittany, that's my doula. I need you to do this. Or, if they try to do something, nope, that's not it. Stop it, But I could call one or the other. So I never felt like I was like overworking either one of them. I remember there was a time where I like looked over and my husband was taking like a quick, like 10-minute cat nap on the recliner in there while the doula was helping me. So I was so thankful that I had the doula, because that's when it dawned to me like, oh man, like he's probably tired. We've been doing this for a while. But most of the time when I was in labor, my eyes were closed. So I didn't really even know, once I got into actual labor, I didn't even really know what time of day it was, because the way that the birth center was, I mean, it was dim lighting, the shades were closed. It was just like this calming atmosphere in there. And so I didn't have the anxiety of thinking like, oh my God, the sun's back up again. And I still hadn't had this girl, right? So that was great. And I didn't even really recognize that until after I had her. Literally, I did most of my laboring in the shower, um, in the bed, and um, by the time it was like pushing phase of labor, the tub wasn't filled up yet, and by the time it was filled up, I got in there, and I was like, I don't even want to be in here. Let me get out. And I just knew I was gonna have a water birth, right? You have these expectations in your head before you go in. But I may have been in that tub for 10 minutes, maybe. Mind you, I haven't said that my water broke.
Yeah.
That didn't happen for me. And because it was really painful, and my midwife was describing that maybe the bag of waters was like bulging. Maybe that's why I felt backside of labor. Like the whole time I felt like it was something trying to come out of my rectum.
Yeah.
Early labor, I was having a lot of like, I was having diarrhea and vomiting and other things, whatever. So I don't think I had anything left in me. But she was like, she could go in and rupture the membrane for me to see if that helped with the pain. So she did. The thing looks like a crochet needle almost. It kind of does, right? And it didn't hurt at all. She inserted it, ruptured it. My stomach deflated immediately. It was just a little, baby, you could tell whatever, but like no more forms in my stomach or whatever. And it really didn't help with the pain, honestly. So I probably could have had her in the in the sack. It wouldn't have felt different, but I wanted to try it. So those are all things, and I said that I wouldn't do artificial rupture of the membrane and all the things, right? But in the moment, I'm thinking of what can be done, to make this a little bit more comfortable. What can we do next? What can we do to speed it up? Type of things. We tried it. So there was that. And then I ran into my cervix. So dilating well, but not effacing that well, so not thinning that well. And so my cervix was kind of like, the way that my midwife described it, was kind of like a hood on her head, right? So we're getting to this point where like she's trying to come, but the cervix keeps like blocking like this. And so I get in like a half kneeling position. And this is also what prompted us to get out of the pool, because she couldn't help So I get like in a half kneeling position or on my back. I can't remember which one I was in. And she kind of used her hand to kind of move the hood out of the way. Does that make sense?
Yeah. Mm-hmm.
And she couldn't really see or really get in the position where she needed to in the water to do that. So that's how I ended up back in the bed for pushing phase of labor. I did a lot of it side lying, with my husband supporting my leg, almost like a football. But when she started crowning and we got her head to come out, I was in half kneeling. So I got one foot down, one knee down on the bed, breathing through, still those low moans. And she was just like, my midwife was like, oh, you're doing so good. You're breathing so well. It's like you know what you're doing, da da da. And my doula was just so happy. I was like, okay, well, finally, this like pelvic floor is like paying off for me here. So, and that's how that went. And then I think I ended up on my side for after the head, and then I honestly want to say I think I ended up on my back when she actually, came out. Because at this time you're exhausted.
Mm-hmm.
And I was exhausted. And I was in the bed, and after every wave, that little small break I got, I just wanted that break so bad.
Yes.
Yeah. Mhm.
Yes.
And so I had her, and she didn't cry. And so my husband said there was this time span where everybody looked a little nervous because once the head comes out, they do want the baby to come out, not they don't want it to be too long. And I don't know, maybe I was taking too long. But anyway, she came out, she didn't cry initially, but after a while she did. And I just remember the tug from like the feeling like the umbilical cord coming out of me and like them like putting her on my chest, like that little tug at my vagina as it's coming out, and then them pulling her up. Like, oh my gosh, this is my baby, right?
Yes.
So they're able to they did everything in the room. My baby never left the room.
Wow.
Um, and I just remember looking around and just telling everybody thank you, and how I just felt so supported because it like the nurses in there like speaking words of encouragement to me throughout the whole time. My husband's like right there. My doula's like trying to take pictures and also right. And I didn't even ask her to, but I'm so happy that she did.
Yes.
Now I can look back on it.
Mm.
So it was a beautiful experience. And then like a couple hours later, my mom and my sister came. I didn't want them there during the labor because I knew it was going to take a long time, and I just didn't want any like spectators, just making it more harder on me, you know what I mean? But they came like right when I wanted them to come, and everything was just like perfect. And I remember asking like, "What's today? Like, what time is it?" It was like 2 p.m. on
Wow.
the 23rd when I had her.
Yeah.
Mhm.
Yeah. Okay, so what does the discharge process look like? Like what had to happen before you left? And then what did your postpartum period look like?
Um, they do, mind you, throughout this whole time, blood pressure, heart rate, every 20 minutes. Okay,
Wow.
so every manually, okay? So
Wow.
these nurses are using manual cuffs, manual checking your heart rate. So that was great. And also Doppler every 20 minutes listening for her. So so that's all throughout. And so they keep doing that after you have the baby too. Um, they massage the uterus, which is so painful after. Oh, I think I grabbed the midwife's hand like, girl, don't act like you didn't see what I just did. Calm it down. But that's important, right? So
Yes.
all of that happens. I was able to take a shower like the next 30 minutes, which was great. So I took a shower. They were looking at my blood pressure, my heart rate really closely. My heart rate was still kind of more elevated than they wanted it to be. So they were monitoring that really closely. They looked and also, Kathy, you would love this. They gave me a mirror when I was pushing.
Did they? Isn't that a blessing? Oh,
It's a blessing. So they checked for tearing. I didn't have any perineal tearing, which is a tear between your vaginal opening and your anal opening, but I had some labral tearing. So like on my lips, what people may call, I had just some from the trauma of giving birth. Okay.
yeah.
It could have been from like midwife trying to help me move my cervix, all the things. So I had some labral tears, nothing that requires stitches. There's a lot of blood and a lot of fluid at the time though. So they're looking, they're trying to make sure and determine if you need stitches for anything or whatever.
Right.
So I did it. So that happened. Um, Massaging the uterus, making sure that it's going down and that happened. Blood pressure, heart rate every 20 minutes, them coming in and out. You're not alone for more than 20 minutes, which is great. I was never alone because my husband and my doula were there, but whatever. So that was good. So that's what they're looking at for me. And I hope I'm not forgetting anything.
Now, did they take your vitals? I'm just curious, outside of the bed, like sitting up or standing or moving?
Sometimes, however I was, during labor, and then after I believe that they did because they asked me, do you feel dizzy? Do you feel lightheaded? Right? Because I took a shower like very quickly after.
Yeah.
And I was like, no, no. And so they were checking, my vitals too as I'm going like from the bed to the shower or to the toilet because I had to. Catherine, I had incontinence like for the first time ever so much. I didn't, if you think about how long I was in labor and how tired those little pelvic floor muscles were,
Mhm.
and just the disconnect between my brain and these muscles at this time. After I had her, I was in my core at this, it's so weak, so mushy, right? My abs. And so I couldn't get up to make it to the bathroom in town. So I basically used the bathroom in the bed and I had those labral tears.
Oh my gosh.
I screamed and screamed, and people ran in that room. I said, I am so sorry. I think I overreacted, but I just was not, I wasn't expecting any of this. Okay.
No, and it hurts so bad. Even if you're sitting on the toilet and a little bit of pee drips on the tear, it's horrible. Yeah, yeah.
I had to get used to that really quickly. So that, um, the, what you call it, the Perry bottle,
Hmm.
best friend, people
Yeah.
like, I know I had a girl in my childbirth class, and she was like, I've seen all these people getting all of these like pads and stuff like that. And she didn't know if it was just like a fad, like just influencers doing it. I'm like, no, boo, you want
Okay.
all of this stuff. You want all of that stuff. So that stuff, if you have it, get it. Um, so yeah, they did her, they got her little footprint and measured her head and weighed her. They did. I mean, if I was a few, I think they might have did like an initial weight and then another weight before we left or whatever. But like, they wasn't rushing to take my baby away from me.
Yeah.
It all happened right there in that room. The nurses were helping me with getting the latch right. They were like
Wow.
educated on that. Um, and so at the birth center in Atlanta anyway, in like 5 to 7 hours, you go home. So I had her at 2, and I want to say I was like back in my house around like 8 o'clock. Mhm.
Yeah. Yeah.
And then the next 24 hours, a nurse came to my house and they did the rest of the things for her, like the heel prick,
Right.
look for type 1 diabetes and all the things, and then check my heart rate again and my blood pressure and all those, and my uterus and all the things in my house, in my bedroom. I didn't have to get out and go anywhere,
Right.
which was great. So yeah, and then we did a telehealth visit, I want to say within the next week or two. And then at the telehealth visit, they did all the mental health screening and breastfeeding counseling and all those things. asked me if I wanted to come in sooner than 6 weeks. I did not. So 6 week follow up with them in person in the clinic. So that's kind of like how that went.
I love how you got the options. I love the vital sign monitoring, especially with mobility. Some moms are asked, why are you wanting to take it out of the bed? Why are you taking it so often? And it's like, it's because it can change in the blink of an eye. And even with your heart rate, I know in terms of the monitoring, you were more on the monitoring postpartum. And I mean, I could just see your stress was a little higher than normal. Your heart rate was higher than normal. And it really can be that you're just going through life. And because you were out of the hospital so soon, without additional oversight, you can really think that you're just, and you have to worry about breastfeeding, and not worry about, you get to indulge in breastfeeding.
Yeah.
You are in your own bed, in your own house. And for the first time, you're able to move around really in 9 months, right? And so it can be one of those things where you just kind of, you take advantage of it because you weren't able to do it for so long, but you have a sweet husband in the house. And I also want to make sure that that you get to shout out Miss Pat and like talk about your breastfeeding class that you had. I guess it was before you delivered.
I did.
She was a part of your team, and then your sweet husband. And so if you could just let people know how that went, because I love your husband. I loved him when I first met him. But after we got to chat postpartum and he got you together, I was like, okay, he's my he's our next Miss Dad for sure. So
Yes. Well, me and my sweet husband, we took a childbirth class at the birth center. It was like a weekend like class. They talked about breastfeeding a little bit there. But then I know Miss Pat, and I told Miss Pat, she was gonna be my lactation consultant regardless. So she's with, I think it's called, is it TLN, the Lactation Network? And they like accept insurance or some insurances. We tried it early on in pregnancy, and it was saying that it wouldn't take my insurance. Well, Miss Pat was like, she sent it to me again in like third trimester. She's like, let's try it again. Let's see. And so we did, and it was approved. So it was free. So me and my husband, one night, we did a virtual like lactation class with her for like, I don't know, 1 to 2 hours. And she educated us a lot. And it was so good because I had taken some classes on my own through Aeroflow, which were also free for insurance. And they were virtual too, but I really liked, just being me and my husband and her, and us being able to ask questions like more directly. It was great. And it was good reinforcement for me for what we had learned from previous classes. And so I recommend this pack to anybody, especially because they may accept your insurance and it'd be free. So that was that. And so after I had her, the initial latch like at the birth center was good, but after that it was the pinching, right? So it was the nipple hitting my baby's hard palate because she wouldn't open her mouth wide enough for my nipple to be on her soft palate. So it was just super painful. And then my nipples ended up being cracked and damaged and all the things. Multiple clogged ducts. Me on the phone with Catherine at like 2, 3 o'clock in the morning. But Miss Pat was able to like do virtual visits with me whenever and taught me like reverse pressuring, and Catherine, teaching me how to like immerse the breast like in some warm water and like to get on all fours and try to nurse that way, and just things to like remove the clog. So it was the first 2 weeks with breastfeeding was difficult. And if you're not educated and knowing that your baby's belly is really small and they only need a little bit during that time, you will freak out and you will be like, oh, my baby's not eating enough. This is painful. I'm gonna just go straight to formula. Like I could see how that would be easier for a lot of people to do. But because I had this, I knew I could call on Catherine. I knew I could call Miss Pat. I got through that first rough 2 weeks, and then after that, because I was letting my nipples heal, I started pumping, and so now I pump more, and I let her latch in there sometimes. So most of the time, she gets a bottle and like pump milk. But Mike was there with me throughout all of that, and throughout the whole pregnancy, because I wasn't really doing chores when I was pregnant because I was nauseous and vomiting and tired. So he really stepped up throughout the whole pregnancy. And then postpartum, we put a bed in our nursery for my mom, kind of like for, mother-in-law to sleep in. But that came in handy for us, right? So he could take the baby in the nursery and I could stay in our room and sleep uninterrupted. This was Catherine's idea. And like immediate, I was sad without them in the room.
Did not like it.
But immediately, my resting heart rate was better. My sleep quality was better. My stress was down. Like that
Immediately, because
immediately.
I promised her husband, I said, listen, I'm going to keep you updated with her vitals and y'all do this. She's not going to be happy with you because if my husband had done this to me, we would have been fighting. However, your girl down to fight, but you're going to have to, you have to put her
Right.
back.
Because yeah. Because as soon as I was sad, but when I went to sleep, I was out. So
Yes,
So
yes.
that helped tremendously. And that's why Operation Mist is so important. And this is why I share with people, not just for pregnancy, but postpartum, because especially if you feel like yourself, like I didn't necessarily feel like my heart rate was high. Um, but I was checking my heart rate. It was on the watch, right? And I had a blood pressure monitor at home, and that's why we tell moms to get that and stuff too. But if you feel like yourself, you go back to doing the things that you normally do, and sometimes you do it too soon. And especially if you keep that up and you have no idea, things like blood pressure and heart rate can be like what they call like silent killers, right? Just slowly getting worse over time, and you don't even know it because you don't feel it. It's not like the nausea and vomiting that you're constantly aware of. It's not like that. So when you are with Operation Mist and they are monitoring you through the watch, you don't have to think about anything but remembering to put the watch on. It's my problem. But as long as you do that, you got somebody that can tell you, like, wait a minute now, tell me about your day. You may have done too much today. And you might be completely oblivious to that. Like, there's no way. I felt fine. I barely done anything. But your body is keeping score and saying something different. And so you want to listen to it. You rather do it early on than to do it later.
Yeah.
Yeah.
Yeah. Because for me, I was so happy that you weren't going back to work right away because you think about it. Some people, they're in that state. And there are things that I love about the birthing center. I love about being at home. And all the description that you had of your experience is what every mom deserves to have,
Mhm,
right?
mhm,
The one thing that I think I would change in both settings is the postpartum hemoglobin check. So making sure that you know how much blood quantitatively was lost during delivery.
mhm,
Because if you lose enough, even if you're not hemorrhaging, you have to make adjustments. Because when you look at the research, it says that if you were to lose 2 liters, then you already see a change in somebody's ability in their physiology. You see a change in their heart rate and their oxygen. It may
mhm,
not be that it's hemorrhage signs, but you have to make adjustments post delivery, and now you have a baby, and so nothing has changed. You have the same support system typically.
mhm,
I know that when I chatted with your husband, your mom and sister weren't leaving at that time, and so some people don't even have that buffer. And so just kind of knowing, okay, well, how much is in my reserves? I think
mhm,
it's important. And so without that, in the absence of that, knowing your heart rate, knowing your oxygen levels, knowing your blood pressure, that's
mhm.
important so that you can adjust as you need to. Um, but having someone in the house, I cannot overstate how important that is. Someone in the house who is like your husband, who is like your sister and your mom, who will really make it to where all you have to do post delivery is take care of yourself and your baby.
Yeah.
Um, and yourself. I mean, because a lot of times they're taking care of the baby too, right? Just kind of helping out.
Yeah.
And so it really does make all the difference. And it was nice, it is nice to be able to see, okay, I slept and it did make a difference. Let me sleep again the next day.
Yeah.
Right. And if that wasn't what fixed it, then we would know, okay, maybe we need to do something different. And it's funny
Mhm.
because people always ask, what does miss mean? What does miss mean? And recently someone's like, I think you should change the S and the T instead of survive and thrive. Because you're not just helping people survive anymore. Or they said change the S. You're not just helping
Mhm.
people survive. It started out
Mhm.
that, right? But now
Yeah.
it's beyond it. And so now I'm thinking about monitor, inquire, suggest, and test. Because if we were to test it and it didn't work, when we monitor again, then we try something else. And it's not, so then we just keep trying until we figure out what's going to make you thrive, right? And you deserve that. Like I said, I just think that you deserve it. And you had such a vast village that you got all the
Yeah.
support that you needed, you know?
And I didn't even know I needed that much of a village, but I do. I don't even want to say did, I do. And I definitely think my experience made me think that we do need to spend more time because birth can be so unpredictable. And we spend so much time trying to plan it, but really they call the shots and you just never know. But postpartum is way more, it can be way more predictable. We need to spend more time postpartum planning than birth planning, in my opinion, through my experience. And that's what I'm going to with my when I'm teaching moms and families, like that's when I want to start to hone in way more.
I love that, Dr. I love that because, and let me not even use that word, because 33% of women are dying during pregnancy and delivery, but the other part is within those first couple weeks and then through that first couple months, excuse me, and then
Mhm.
that first year postpartum. And so
Mhm.
I love that you said that because I was going to ask you, what advice? So we're going to kind of round out the podcast with any last words that you have and any advice that you would give to moms and if you would like to providers. You have a lot of followers, people who love looking at your content and they know your expertise, the vast knowledge that you possess. And so what would you say to a provider who is supporting moms, and what would you say to a soon to be mom or someone who knows they want to be a mom someday? What advice would you give to them?
Definitely to providers is never withhold information from families. What I loved about my experience was that it kind of like coincided with how we teach with evidence-based birth. Every visit at my birth center, like I was given information, and from the information, I was asked to make a decision. It was definitely happening through me and not to me, okay, my birth experience, because I got risk and benefits of every little intervention for me and for her. And through the information and through my preferences, I was able to truly make an informed decision. Because we say we give people informed consent, but we really don't. Because we don't get information, we just get a form and sign most of the time. But I think it's important for people's pregnancy, because regardless of if things go as planned, if I as a mom can say, well, I knew about it, I knew about this and I knew about that, I knew this could have happened if this didn't happen. You just feel a little bit more satisfied, a little bit more confident that everything happened for a reason almost. But when you don't get the information into the back end, then you start to have the well, what ifs and all the things, and you don't feel as comfortable with your experience. But if everything is like laid out to you before, it makes a big difference whether or not it goes, whether or not the decision I made is what happens or not. If I knew about the other thing that could happen, it makes it easier for me to
Yeah.
digest my experience. So that's the thing I would tell providers: lay it out, and don't lay it out with negative connotations and fear mongering. Don't put that in it. Just pure
Just the
given information.
facts.
Just the facts. That's what I was given. And sometimes I wanted people to direct me a little bit more, like, tell me what you would do, but they did not. At the birth center, it was just like here and here, and you decide. And I'm happy that it was like that. That's what I would tell providers. And then for moms, again, I would really hone into spend more time planning your postpartum than your birth. Learn as much as you can about the options that are available to you, because a lot of moms don't know about options until the back end. And like I said, they don't feel good about that. But if you learn all the options before and know the things that could happen if plan A don't work, what plan B could be, what plan C could be, you feel more empowered because you're educated. Education is power. So learn all that you can about the birth and the things that can happen. But when it comes down to your planning, plan your postpartum.
Yeah.
Yeah.
Yeah. I
So
love that. Oh my gosh. Okay, so everyone, I know where we can find her because I stalk her at Dr. JT, the pelvic PT on
you
Instagram. And were you going to say something else?
uh-uh.
Okay. For your childbirth education needs, for your pelvic floor needs, and now you know she will come to you virtually, which is super effective. And I'm so happy that you explained why it could be. But if you need anything, you can reach out to her. And I am just so proud to see you. I'm so happy you have your sweet baby on here. Your transformation, while I don't even think that it should be called that, it is just you have grown beautifully over the years, and your sweet baby has a mom who had an experience that was not an easy one, but you navigated it. And now you have even more tools in your toolbox to help other moms navigate. And I just think about how this generation of women, when you said it's not enough to be given an informed consent to sign, you
Mm-hmm.
really need to have information. When people like you give birth, you are birthing the next generation of women who will refuse to have healthcare done to them and
Mm-hmm.
not through them. And I think that is why every person who connects with us, whether they decide to become a part of Operation Mist or not, gets a long conversation at the beginning so that they understand that regardless of what you decide, it is your body, it is your baby, it was designed to give birth. And so your pregnancy didn't look the way you thought it would,
Mm-hmm.
but you had a beautiful birth, and you still got to birth your way. And that's what I want people to hear. Sometimes at the beginning, if things don't go the way you think they're going to go, you're already thinking, well, I might go into labor early. I might need an induction. I might end up at a C-section. Don't even think like that. Just take it day by day. Continue to make the best decisions that you can make for you. And then you end up with an experience like the one that you had. And I could not be more grateful to God that He gave you this beautiful experience, this beautiful team, because that's what you've been to mom after mom after mom, year after year after year. And so now you get to have all of that poured back into you, and you deserve it. 100%
Mm-hmm.
you deserve it.
Thank you.
Yeah, I love you. I love
That
you
is so good. I love you
so
too.
much. And I'm so grateful to do this with you and to continue to monitor with you. So thank
Yes, I'm
you.
excited to start back monitoring. I'm so excited.
Me too.
We just gotta keep this thing going. Baby after baby, mom after mom.
Yes, yes.
Yeah.
So I love you, and thank you again for coming on. I'm so excited for every mom, every family, every provider who will hear this episode.
Oh, yay. Love you.
Love you too.